Information that you guys can hear me okay? Just from a nod of the head of the people that are on. Great, thank you, Mandy. Excellent. Welcome everybody to the staff forum for Charlie's Aussie Park. I'd like to start today by acknowledging the Noongar people as the traditional owners of custodians on the land on which we're working, and pay respects to elders, both past, present and emerging. And especially today on Sorry Day and at the beginning of Reconciliation Week, which runs National Reconciliation Week once next week from the 27th of May till the 3rd of June. And I will make further comment on that. It's important North Metro recognises and respects and values the Aboriginal cultures as we walk the path together. I wanted to just start today by talking about some of the senior leadership changes across North Metro that are happening. As you probably are all aware by now, Janet has moved on to Canberra and onto a Deputy CE role in Canberra Health. And we've got Jodie Graham, who's most of you will probably know, was at a previous co-director here in the surgical division and an anaesthetist here at Charlie's, and she's currently the ED at Women's and Newborns Health Service, and she's coming to be the executive director for a 6-month period while this position is being advertised. Jodie's starting, I believe, on the 13th of June, and I'm here in the interim and will be handing over to her at that time. In addition to that, we also have Professor Georgia Skanda coming as the Director of Clinical Services on the 7th of June. And he's coming to take over from Ajitha Nair, who's moving into a 0.3 role in North Metro as the Area Director of Clinical Services. So Ajitha's moving into that area role and going to be providing support across all of the sites, which will be very useful. So we will welcome George when he comes on the 7th. He'll have a couple of days of handover with Ajitha. A couple of things around workforce process and agreements. Obviously, there's been quite a lot of change. There's been some changes in the delegation and authorization schedules. So can you please make sure that in terms of, we've tried to push the delegations down so that not everything has to come up to me or to the CE. So can you please make sure that you familiarize yourself with the changes? And the FTE management is on the Health Point workspace. Executive approvals, I'm continuing to look at those once a week. So if you do have things that need to come up and have Tier 2 approval, I am looking at those, and they will be the ones that need to be pushed through to the CE. That will happen. They are getting scrutinized. So if you need new positions, we will be looking at those quite critically, given that we're coming to the end of the financial year. So if we can just make sure that when you're putting up any of your submissions, that you actually think about how you may be able to offset it if that is possible. And I do appreciate that we are in extraordinary circumstances at the moment, and that really we have nothing else to give, and we really do need more at the present time. So I appreciate that. One of the other things that WA Health has recently introduced is that casual employees are now eligible for long service leave. So if you or any of your staff are casual employees and they have been with us long enough to get long service leave, they will be eligible for that. And we've put a link there, and there'll be a link in the presentation for you. And sorry, I can't actually see hands. So Nat, if there is anybody with any questions, can you just let me know? Sorry, my screens have both gone to presentation mode. I wanted to just talk about a couple of hotspots that I've seen while I've been here. One is the long stay patients, and I appreciate that on a number of our wards, we have patients that are either NDIS patients or patients that we've been unable to repatriate to the place they originally came from. This is an issue across a number of wards, and it's also an issue across all of the HSPs. We are working with Nicole O'Keefe's, having real trouble speaking, Nicole O'Keefe's team at the Department of Health to try and work out how we can facilitate transition back of the NDIS patients and also the TCP patients. So there are a number of smaller groups working, but I've asked that we get together and look at the more strategic view of how this can be achieved over time. So hopefully we will start to see a shift in the long stay patient, the blocks that we have at the moment. If anybody has particular blocks, and I know there's certainly some wards that have already contacted me, but if you have particular patients that you're concerned about, I'm more than happy to take either via email or you can SMS me or call me. Just let me know what the circumstances are, and we'll see if we can try to get some traction on if the person is medically stable and ready for discharge, how we can help to facilitate that. You'll probably also have heard in the news recently around St. John's Ambulance and ramping. The minister has a particular focus on reducing ramping, which in an ideal world would be great, but we don't necessarily have the capacity within our services to do that. What we are doing is trying to, in the ED, we're trying to, as soon as ambulances come, we're trying to assess and provide a space within the ED that they can bring the patients into ED and then they can get back on the road. That's not always possible, but we're trying to reduce it as much as we can. In order to do that, though, as you will appreciate, we need to have somewhere to transfer the patients from ED up to the wards. And so I really want to thank you very much. I've seen a significant change in our practices around discharging patients as soon as we can. So the ward rounds are happening. Staff are going and looking and identifying who can be moved. We have really good use of the discharge lounge today. We're using South Perth and Woods Ward. So I really do appreciate your continued focus on this to try and clear out patients that are in the ED so that St. John's can get back on the road, but also to help us provide safe care to patients. There have been some changes to the process around furloughed staff. So I think previously you were all asked to complete forms and it was sent through to your managers and then it was coming up to me as the ED and it was going to the CE. We've stopped that level of review, but except for critical areas. So if it's ICU or oncology, there's a few key areas where if it's a high risk area, it still comes through to me, and that's because it's automatically now done on an e-form. So if you work in a high risk area, the e-form, fill it out, it goes to your manager and it gets kicked to me and I sign it off. The process for after hours isn't quite, I don't think we've quite tweaked it yet. I don't think we've quite got it. We will continue to work on that. We were trying to go through the after hours on call but I'm not sure that that's working as efficiently as we would like. So we will continue to look at that. If anybody has any ideas, I'm happy to hear from you. I'll just stop there. I can't actually see hands, but is there anybody that have any questions about any of that I've talked about so far? Silence. That's good. Okay. They had some things that they wanted to check on before they starting on June 9th. So you'll be able to ask any questions that you have in relation to that, and they should be able to provide you with some updates. Just to give you an update on some of the infrastructure projects that we've got running. So the C14 update, as you can see, we've got the in-ground plumbing works have been completed and the steel works are being installed. The inner courtyard the concrete floor has been poured. We've got temporary catering commissions so that we can provide food services to C16. And we're trying to make sure that the look and the feel is the same for the ground. So we've got a cohesive design for the ground floor of C block. The landscaping and interior courtyard of, and the new entry from Hospital Ave is currently under development, and hopefully that will look seamless once we get the upgrades for C block. In addition, we've got some works going on at Osborne Park. So there's a 30-bedded modular ward, Ward 7, designed for rehab patients. That's due to open at the end of July this year. And as you can see from the photo, there's lots of construction going on at the moment, and we're working on what the internal fittings and the other fixtures will look like. The car parks and the pathways are being assessed. I know there has been some discussion around the pathways being steep and not necessarily being conducive to pushing patients or food trolleys or other items up and down. We are looking at that and finding ways to try and minimize the risk. So there is a group currently discussing that. The fitting fixtures and equipment, which has already been delivered, is in storage, and that once the demountables are, or the modular ward, I should call them, not demountables, are in place, they'll be installed. We have also signed a new contract around the patient entertainment system, and that will be installed as well. And the landscaping and external cladding it'll be tried to be seamless with the environment that it's already in. I know this is a lot of ongoing change for staff at OPH, and I really do thank you for your support and your ongoing commitment to getting this ward up and running. An opportunity, if you are interested and have some feedback that you'd like to give, there is a review of the Health Services Act being undertaken at the minute. And there's a virtual session to look at what the operational and practical effectiveness of how the WA health system is structured. And what the impact on workforce relationships and what some of the processes and systems are across all the sectors. There's a virtual session, and there are some dates and times there, which again, this will go out to you guys. This will be on the hub, so you can have a look. If you're interested in attending, you can register via the link that is there. Employee assistance program, there's been some changes to our service providers. So we've got LifeWorks was our previous one. That's going to cease on the 31st of May. And you can continue to access that until your current entitlement is exhausted. And People Sense by Altius will be joining the EAP provider as of the 1st of June. And the EAP and Hub internet pages will be updated with the new contact details. So I think that's early next week. So if you need to access EAP, just go onto the Hub and you'll be able to see the contact page. And I guess I should just really point out that at this time, obviously, all of us are under significant pressure, particularly staff on the floor caring for patients and dealing with families. Look, I really appreciate your commitment to ongoing care, but also recognize that you are under an extreme amount of stress. So please do not, if you need to have support, please make sure that you do contact EAP. As I mentioned at the beginning, their National Reconciliation Week is from the 27th of May to the 3rd of June, and it's entitled Be Brave and Make Change. There is a list of upcoming events at the link below. So if you are interested, please encourage your staff. If you could maybe print this off and put it up in your staff rooms, and encourage your staff to get involved. in this in the activities. The 23rd to the 27th of May was Volunteer Week, and I took the opportunity to provide Don Mullally with his badge. Don is a patient transport volunteer for us. These guys do a great job, and we've sent out thank you letters, individual thank you letters to every one of them, as well as providing them with the badge. You can see up in the top right-hand corner, that's the design of the badge. So every volunteer got a badge. And on the right-hand side, you can see OPH. Lorraine Beatty is presented her volunteers with badges and thanked them for their commitment. And without these guys, we would really struggle. So, and particularly during this time of COVID, for them to still be on deck is great. In addition to COVID, obviously, we've got a flu season that is upon us imminently. And we want to make sure that we keep our vaccination rates up. So please, we encourage you to get your flu vax and encourage all your staff to get their vaccination. There are vaccination stands or hubs down in the Watling Walk, and if you could please encourage your staff to do so, that would be great. And really, that's the update that I've got for you today. Are there any questions from anybody or anything I can try to provide the answer to? No questions at all.
Teresa, is Claire Matthews here. I think Stacey Dix was wanting you to repeat the Women's and Newborn Service information. On the
Sorry,
chat.
can you say it again, Claire?
Stacey Dix has put on the chat, please repeat the WNSRP information.
Okay, there wasn't any specific information. It was just to say that as of the June, sorry, let me just look, as of June 9th, I believe it is, they will be giving regular, updates. So I didn't provide any specific information around the Women's and Newborns Relocation Project. They were due to give a presentation today, but they needed to, they wanted to have some more information and some more time. So they agreed to provide regular staff forum updates starting on the 9th of June. Any other questions? And sorry, I didn't see the comment, Mandy, that I was freezing intermittently. I hope that the information I imparted went across okay. Okay, well, if there is nothing else from anybody, unless there's something I'm not seeing, thank you all very much. And I really do appreciate, again, your commitment to caring for the patients that are on your wards, and look after each other, and make sure you take some time for yourself if you have, when you can find time. Thank you.
Thanks, Teresa.
Thanks, Teresa. Thank you.